Okay, we will be talking about assisting a client with ostomy care. And what is an ostomy? An ostomy is a surgically formed opening in the body. There are different types of ostomies and they have a different purpose. First, we have the ileostomy. This is an opening in the small intestine that allows waste or stool to leave the body. A client may have an ileostomy if the small or large intestine is diseased. Next, we have the colostomy. This is an opening in the large intestine that allows solid waste or stool to leave the body. A client may have a colostomy if the large intestine is diseased or injured. Next, we have the urostomy. This is an opening in the abdominal wall that deters urine away from the bladder. A client may have a urostomy if they have an injury or disease that prevents urine from being eliminated through the bladder and urea. We have tracheostomy. Tracheostomy is an opening in the trachea or windpipe. A client may have a tracheostomy if their larynx or voice box has been injured or removed, if their trachea has been injured, or if they have difficulty breathing due to lung problem. We have the gastrostomy. This is an opening into the stomach. A client may have a gastrostomy if they cannot chew adequately or swallow safely. Now let's go to basic information about digestion. In order to get energy, a person needs to eat food and digest it. And here is how digestion works. Food is chewed in the mouth where it is mixed with saliva, which helps to break it down. Food is swallowed and goes down the esophagus into the stomach. In the stomach, food mixes with digestive juices. These juices are very strong acids. Next, the foods move into the small intestine. Nutrients are absorbed into the bloodstream from the small intestine. Anything that cannot be absorbed into the body passes into the large intestine. Now it is called waste. Water is removed in the large intestine, so the water becomes more solid. This solid waste or stool is stored in the colon and then pushed out of the body through an opening called anus. Now, let's go to basic information about ileostomies and colostomies. An ileostomy is an opening that is surgically formed in the small intestine. Client may have ileostomy if their large intestine or small intestine is diseased. A colostomy is an opening that is surgically formed in the large intestine. Clients may have a colostomy if their large intestine is diseased or injured. Ileostomies and colostomies allow waste stool to leave the body. How the waste looks and smells will depend on where the ostomy is located in the digestive tract. When stool comes from an ostomy that is higher up in the digestive tract, it has less odor. It is more liquid in consistency. It is eliminated more frequently from the body. When stool comes from an ostomy that is lower down in the digestive tract, it has more odor. It is more solid in consistency. It is eliminated less frequently from the body. The stool leaves the body through an opening called stoma. A normal stoma is shiny, wet, and dark pink or red, like the inside of the mouth. Stomas are not painful. Now let's go to information about Stomas. Not all stomas look alike. Stomas can extend out from the surface of the skin and be level with the skin or indent into the skin. Stomas can be round like a flower bud or oval. Stomas can be located in different places on the abdomen. Some colostomies have two stomas, and this is called the double barrel stoma. Okay, the stool is collected in a pouch. The pouch is designed to protect the skin, contain waste and odor, be comfortable, allow the client to participate in daily activities. Most clients are concerned about odor, so pouches are odor resistant or odor proof. If there is an odor, it may be because the pouch is not properly sealed or was not properly cleaned. Some people with colonostomies may also irrigate. Irrigation is like an enema given through the stomach. The purpose of irrigation is to allow the client to leave the home for a period of time without eliminating. Now, your roles in assisting with ileostomies, colostomies, and urostomies. You may assist a client who has an ileostomy or colostomy with many different tasks, and this include selecting and preparing food that is appropriate for the client, assisting the client to eat food, changing a pouch, emptying stool or gas from a pouch, cleaning a reusable pouch, irrigating in a case of colostomy only, and caring for the skin around the stomach. Under special circumstances, you may also assist a client with urostomy. The task you may be asked to do is change or empty the urinary drainage pouch. Clients with colostomies can enjoy the same foods they eat before their surgery. Occasionally, a client may have a problem with odor, gas, constipation, or blockage, diarrhea, irritation to the stomach. Okay, let's see that there are diet that needs to be considered with the patient with colostomy. These problems can be avoided by paying special attention to the diet. Foods that produce odor. They have eggs, fish, lettuce, parsley, asparagus, spinach, garlic, cranberry juice, onions, yogurt, beans, and applesauce. Foods that form gas. They have beans, cranberry juice, cabbage and related vegetables, onions, carbonated drinks. Beer can also irritate the stomach, fresh yeast, sweets. Food that reduce gas, yogurt. Foods that cause constipation, boiled milk, dry cheese, chocolate, nuts, prunes, red wine, beer, raw fruits and vegetables, spinach, and beans. Now let's go to a diet for a client with an ileostomy. Clients with ileostomies need pay attention to what they eat and how they eat. It is important for these clients to eat in a well balanced diet. In addition, this client should chew food slowly and carefully, drink a lot of fluids, eat foods that are rich in potassium like bananas, tomatoes, and oranges. Clients with ileostomies can sometimes get a large mass of undigested food in their intestine, which blocks their stool. Some foods can cause blockage include nuts and seeds, popcorn, raw vegetable, cabbage, cauliflower, broccoli, Brussels sprouts, kale colored greens, celery, string beans, Chinese vegetables, coconut, raisins, and other dried fruits, raw fruits, especially pineapple and citrus fruits, fruit skins, mushrooms, and shellfish. Call your supervisor if you think your client may have blockage. The symptoms to look for are nose stool or watery stool, green stingy stool, and cramps, or sometimes throwing up in severe cases. Let's go to equipment for urinary and bowel care. We have adhesives. This enables the patch to stick to the skin and or face plate. It comes in three forms: the double face discs, spray cements, and tape. Next is adhesive removers or solvents. These remove the adhesives that build up on the skin or the face plate. They are irritating to the skin and must be used carefully. They come in many forms: liquid, sprays, and wipes. Next, belts. These help hold a pouch in place. They attach to either side of the faceplate or pouch. They are usually made of elastic. We have condom catheter. This is a condom that is placed over the penis in order to drain urine. It has a tube at one end that is attached to a drainage bag. Deodorizers. These control odors from the stool. They come in many forms: liquid deodorant for washing, tablets or drops for inside the pouch, and spray for room odor. Fasteners. These secure the bottom of an open-ended pouch. Paper clips, rubber bands, or clamps can all be used as fastener. Germicides. These disinfect the pouch and other equipment. They are used when soaking a used pouch or inside the fresh pouch. We have irrigation belt. This holds the faceplate of the irrigating sleeve in place. Irrigation container. This is a container for solution, tubing, and water flow regulating valve or the clamp. It looks like an enema bag. It stores and delivers irrigating solution into the intestines. We have the irrigation sleeve. This is a large plastic bag that is open at the bottom and the top. The top allows access to the stoma. The bottom allows drainage into the toilet. It is attracted to the rigid faceplate. It is attached to the rigid faceplate. Lubricant. This is a water-soluble gel. It helps to ease the cone tip or the catheter into the stoma. Mirror. This enables the client to see the stoma during care. Pouch covers. These fit over the pouch. Pouch covers make the pouch more attractive. They also prevent irritation and perspiration or sweating under the pouch. Skin barrier. This protects the skin around the stoma. It comes in many forms: powder, gel, ring or washer, paste, wafer, and square. Skincare products. These maintain the skin and prevent problems. Skincare products come in many forms: ointments, pastes, sprays, wipes, lotions, gels, and powders. Skin sealants. These provide protective film over the skin. Skin sealants are used under tape, cement, or adhesives. It comes in many forms: sprays, liquids, gels, and wipes. Stomach cap. This is a tiny pouch or cover that fits over the stoma. It may be used by a client who irrigates, cleans out the colostomy. We have the stoma measuring guide. This is a pattern that is used to measure the size of a stoma. They can be used to cut out the faceplate or barrier opening. Some clients have their own specially made patterns. So now let's go to checklist of assisting with changing a colostomy or ileostomy pouch. Explain to client what you plan to do. Ensure privacy. Wash hands. Gather equipment like a clean pouch and faceplate, skin barrier, deodorizer, adhesive or cement, solvent or adhesive remover, gauze squares, tape, belt enclosure, washcloth or paper towels, mild soap, water, gloves, trash container. Prepare a clean pouch system according to the client's routine or the direction of the care plan. This may include cutting opening in skin barrier and or pouch using a pattern, applying adhesive cement or double-faced disc or reusable system, and adding deodorizer to the pouch, securing the bottom of an open-ended pouch. Put on gloves. Empty open-ended pouch if necessary. Remove old pouch, faceplate, and or skin barrier according to client's routine or direction in the care plan. Remove any adhesive on skin with adhesive remover if indicated by the client's routine or direction on the care plan. Do not rub or scrub. Clean stoma and skin around stoma gently with soft cloth or paper towel, mild soap, and mild and warm water. Do not rub or scrub. Pat area dry. Observe condition of stoma and skin. Look for redness, raw skin, bleeding, discharge, or client's complaints of pain or soreness. Cover stoma with gauze square. Apply skin sealant if used according to the client's routine or directions in the care plan. Prepare and apply skin barrier if separate from the pouch, according to the client's routine or direction and care plan. Sealant may be applied directly to the skin or to the pouch first. Do not apply sealant under the skin barrier. Remove paper backing from self-sticking disc or use adhesive or cement to prepare skin and pouch for a seal. Remove gauze square covering stoma. Center faceplate opening over stoma and press and seal to skin. Make sure air is removed from pouch. Tape edges of faceplate to skin if indicated by client's routine or directions on care plan. Attach belt if indicated by client's routine or directions on care plan. Discard soil supplies and disposable equipment. Clean and store reusable supplies and equipment. Remove gloves and wash your hands. Record that pouch was changed. Report any problems such as a change in the appearance of the stoma, bleeding from the stoma, irritation or bleeding of skin, change in odor or appearance of stool, client in discomfort or pain, or leaking equipment or leaking that does not fit well. Now let's go to assisting with emptying an open-ended ileostomy or colostomy pouch. Explain the client what you plan to do and ensure privacy. Wash your hands. Gather equipment, squeeze bottle or bulb syringe. Pitcher of water, deodorizer, gloves, tissue or paper towels, container for receiving contents of pouch. Position client so that pouch can be emptied. Put on gloves. Open the bottom of the pouch so that the contents can drain into the container. Flush emptied pouch with water from squeeze bottle or pitcher. Allow water to drain from pouch. Use tissue or paper towel to dry outside the pouch. Squeeze pouch to get rid of any air. Close and fasten end of pouch securely. Clean and store reusable equipment. Remove gloves and wash your hands. Observe, record, and report any problems such as leaking from the pouch, blooded drainage, or client discomfort. Now, let's go to assisting with cleaning a reusable pouch. Explain to client what you plan to do. Ensure privacy and wash your hands. Gather equipment like adhesive remover, detergent or special pouch cleaner, brush, container, soaking solution, paper towels, talcum powder or cornstarch. Put on gloves. Remove buildup of adhesive from faceplate by rubbing with finger or using adhesive removal. Rinse pouch, rinse pouch with cold water to remove any stool. Wash inside and outside of pouch using detergent or special pouch cleaner. Brushes inside of pouch with appliance brush. Rinse pouch thoroughly. Soak pouch in container filled with soaking solution for length of time indicated on care plan. Remove pouch from solution and rinse thoroughly. Hang pouch up to dry. Separate sides so that they are not sticking together or stuffed with wadded paper towel. Allow pouch to air thoroughly. Powder the inside of the pouch with talcum powder or cornstarch after it is dry. Store pouch. Remove gloves and wash hands. Observe, record, and report any problems such as crack or split equipment. The next skill checklist is assisting with colostomy irrigation. Explain to client what you plan to do. Ensure privacy. And wash your hands. Assemble equipment, irrigation container, irrigating solution, thermometer, toilet paper or paper towels, belt, irrigation sleeve, cone tip, catheter tip, lubricant, clamp for tube, closure or clip for irrigation sleeve, clean pouch and gauze. Put on gloves. Fill irrigation container with the amount, type, and temperature of irrigating solution that is specified in the care plan. Unclamp water flow regulating valve and allow irrigating solution to run through tube to get rid of air, then reclamp the valve. Assist client into position for irrigation. Hang or hold filled irrigation water container so that the bottom is level with the client's shoulder or as specified in the care plan. Remove colostomy pouch or dressing and wipe off excess mucus or stool. Center the faceplate or irrigation sleeve over colostomy stoma and attach the belt to both sides of the faceplate. The belt should be snug but not tight. Place irrigation sleeve between the client's legs with bottom touching water level in the toilet bowl. Lubricate cone tip catheter tip. Insert one tip or catheter tip into colostomy stoma. Hold tube in place. Do not apply pressure or move. Regulate the flow of irrigation solution using the water flow regulating valve so that it meets the client's needs. Client should feel full but not cramped. Allow solution to flow into colostomy. Clamp tubing before last bit of water and leaves the tube. Observe the client for discomfort, cramps, or pain. If the client cramps, shut off the flow of water while the client takes deep breaths until pain or cramps stop. Discontinue irrigation at the client's request. Keep cone tip or catheter on colostomy stoma momentarily. Remove cone tip or catheter from colostomy stoma. Close top of irrigation sleeve. Allow time for irrigation fluid and stool to be passed through stoma into irrigation sleeve and out into the toilet. Close lower end of the sleeve by folding up sleeve bottom and using a closure or clip. Assist client to move around to enable remaining stool to pass. Remove irrigation sleeve and belt after irrigation procedure is complete. Clean stoma and skin around stoma. Apply a clean pouch or gauze dressing. Clean reusable supplies. Throw away disposable supplies. Remove gloves and wash your hands. Observe food. Observe, record, and report the irrigation was done and any problems such as the client having discomfort, cramping or pain, inability to insert cone tip or catheter. Client refused to have irrigation, not enough fluid return, and changes in client's condition or behavior. Okay, next is assisting with urostomy. Under special circumstances, you may assist a client with a urostomy by assembling necessary equipment and supplies, positioning the client, removing wrappings from any disposable items, removing or applying a belt or pouch, applying a dressing, emptying a pouch, disposing of used equipment and waste materials, cleaning and storing reusable equipment and supplies, observing, recording, and reporting. The supervising nurse will show you how to do any of these activities if you are asked to assist with them. These activities will be indicated on the care plan. Okay, now let's go to a checklist number 5. And let's go to assisting with emptying a urinary drainage bag. Explain to client what you plan to do. Ensure privacy. Wash your hands and assemble equipment like measuring pitcher, containers, soap, and brush. Put on gloves. Put measuring pitcher below the drainage bag. Observe the condition of tubing, clear or has particles in it. Take the drainage tube on the bag out of its holder. Unclamp and open the drainage tube on the bag, being careful not to touch the end of the tube. Drain urine from the bag into a measuring pitcher. Clean the end of the drainage tube as directed by the care plan. Clamp the drainage tube and put it back into its holder, being careful not to touch the end with hand or anything else. Measure the amount of urine if directed by the care plan. Next is observe the color of the urine, odor of the urine, whether mucus or blood was present in the urine, and condition of the drainage bag. Empty urine into the toilet. Rinse pitcher with cool water. Clean with soap and brush. Store clean pitcher. Remove gloves and wash hands. Record the amount of urine if directed by the care plan and observations. Report cloudy, strong smelling, or bloody urine. Report if there is only a small amount or no urine in the drainage bag when it is scheduled to be drained. Next is measuring urinary output. Explain to the client why it is necessary for you to measure their urinary output. Ask the client to use a bedpan, urinal, or commode when they need to urinate. Ask the client to tell you when they need to pass urine. This will not be necessary with the client who has a urinary drainage bag. Wash your hands, gather equipment, put on gloves, pour or drain urine from the bedpan, urinal, commode, or urinary drainage bag into measuring pitcher that is on a flat surface. Record the amount that is in the pitcher or the urinary drainage bag. Discard the urine unless a specimen is needed. Clean the reusable equipment, store the reusable equipment, and wash your hands. Observe, record, and report any changes in condition or behavior such as strong smelling urine, cloudy urine, blood in the urine, very small amount of urine, or if the client has pain or difficulty when urinating. Now, let's go to assisting with the use of a condom catheter. Explain to client what you plan to do. Wash your hands. Assemble the equipment and supplies you need. Condom catheter, tubing, soap, and towel. Put on gloves. Maintain client's privacy. Expose genital area only. Wash and dry penis carefully. Observe skin of penis for sore. Report presence of any sores or raw areas on or around the penis. If there are sores, proceed only with permission of the supervising nurse. Attach condom to tubing if necessary. Roll condom catheter onto penis as directed on the care plan or by the supervising nurse. Check that tubing is 1 to 2 inches below the tip of the penis. Check that the tip of the condom is not twisted. Remove gloves and wash hands. Record the application of condom catheter and or presence of sore or raw areas. Okay, the next one is assisting with cleaning and skin catheter tubing. Explain the client what you plan to do. Wash your hands. The equipments are wash basin, disposable bed protector, soap, washcloths, and towel. Put on gloves. Maintain client's privacy. Place client on back so that the catheter and urinary opening are exposed. Put towel or disposable bed protector under client. Wash the genital area gently with soap and water from front to back. Do not pull on the catheter, but hold with one hand while wiping the area with the other. Gently push back for skin or an uncircumcised male before cleaning. Observe area around the catheter for sores, crusting, leakage, or bleeding. Dry area with towel. Clean the catheter tubing as directed by the care plan, starting with the tubing closest to the client. Position the client so that the catheter and tubing do not pull and are free from all kinks. Tape tubing to the client is directed on the care plan. Dispose of any dirty water into the toilet. Discard disposable equipment. Remove the bed protector or towel. Clean and store reusable equipment. Remove gloves and wash hands. Record time catheter care was done. Observe, record, and report any changes in client's conditions or behavior. Okay, next one is what to observe, record, and report when with ileostomy, colostomy, urostomy, or catheter care. The best time to observe during ileostomy or colostomy care is when changing a pouch or assisting with colostomy irrigation. What to observe when changing a pouch? The client, is the client in pain? Does the client feel full or swollen? Is the client aware of any changes related to the ostomy? The stoma, has it become larger or smaller? Is it sticking out or sinking in more than usual? What is the color? It should be red and moist. Discharge from the stoma. Have there been any changes in color, amount, frequency, or odor? Is there diarrhea? Is there blockage or constipation? The skin around the stoma, does it look different from skin elsewhere in the body? Is it sore, red, bleeding, or swelling? Is there discharge? The abdomen, does it feel hard or swollen? The equipment, pouch and faceplate, is the pouch leaking? Does the equipment fit okay? Are there cracks in the pouch? And what to observe during colostomy irrigation? Certain things aren't normal during irrigation. There is an odor like a bowel movement. The client may feel full. The client may feel cramping. You can try to control cramping by expelling air from the tube, using warm solution, not hot or cold, not letting the solution flow in too fast, shutting off the flow valve and encouraging the client to take deep breaths. If the cramping continues for a long time, stop irrigation and call the supervising nurse. There are certain things you should observe for during irrigation. How much stool is expelled? If not much stool is expelled but the client is eating normally, it may be necessary to wear a pouch. Changes in the irrigation routine. The time of irrigation, the amount or type of irrigation, any increase in the time it takes to irrigate, any stool that passes between irrigations, the client's reaction, complaints, acting upset or disgusted, refusing to look at the equipment during irrigation, asking the worker to do more than is on the care plan, putting off or refusing to do care. And what to observe during catheter care. The best time to observe during catheter care is when providing skin care or emptying a urinary drainage bag. The client Is the client in pain? Are there sores or raw areas on the client's skin? Is there bleeding? Is there leakage around the catheter? And the urine. Is the urine cloudy, bloody, or strong smelling? Is there only an small amount or no urine at all when you are scheduled to drain the bag? Okay, the next one is, I believe, about tracheostomies. Okay, trach is a surgically formed opening in the windpipe. The windpipe is the passage for air to travel to and from the lungs. It is called the trachea. When we breathe, air enters the mouth and nose. It then passes over the voice box and into the trachea. From there, air enters the lungs. Clients may have a tracheostomy if the voice box or larynx is injured. The larynx is removed due to a disease like cancer. The client has lung problems that make breathing difficult. Some clients may have their larynx removed. If they do, they may not speak normally. Instead, they may have an artificial larynx or communicate by signs or writing. Clients who still have their larynx may have a voice that sounds different. They may also cover the opening in their trach with their fingers in order to make sounds. Clients may need a scarf or high collar in cold weather. Clients with trach do not breathe all their air through the nose and mouth. Normally, air is warmed up when it enters the nose and mouth. Clients are prone to respiratory infection. The nose and mouth keep air moist and filter germs out of the air. The trach does not. Equipment must be very clean. Always wash your hands thoroughly. Clients with trach can generally eat a normal diet. Your role in assisting clients with tracheostomies. You may assist a client who has trach by keeping the skin around the opening clean and dry. Clean with mild soap and water. Dry thoroughly and gently. Do not use commercial gauze, tissues, or washcloth. A special gauze will be provided, keeping discharge from building up around the opening. Changing the dressing when it is moist or discharge builds up. You may not assist a client who has a trach by performing non-permissible tasks associated with changing a dressing, inserting or removing the outer tube, caring for a trach that shows any problems like skin irritation. You will need to take certain precautions when assisting clients with trach. Prevent infection. Keep tubes and equipment very clean. Keep your hands clean. Any piece of equipment that falls on the floor must be sterilized. If the inner tube ever falls on the floor, you may not sterilize it. Instead, call the supervising nurse and use a replacement tube. Ensure that nothing gets into the trach tube because this can cause choking. Be careful of things that shed or fray like tissues or gauze. Be careful of dust. Be careful of water. No swimming. When showering, make sure the opening is covered. If the client takes a bath, make sure the water is not too deep. Be careful of shampooing or shaving. Know what to do if the tube comes out of the airway. This will not be a concern for some clients. Check the care plan, know the emergency procedure for your client. What to observe? The opening stoma. Look for mucus or moisture that has collected, crusted, or become hard. This can plug the opening. Record and report any crusting or plugging. The skin around the opening. This skin should look like other skin. Record and report any inflammation, redness, sores, or areas that look raw. The outer tube. This tube should be in place at all times. Record and report any change in position. If the tube comes out, follow the emergency procedure. The type and amount of discharge. Cough up. Discharge normally looks like saliva and has no odor. Record and report if there is more discharge than usual, or if the discharge has an odor, is thick, yellow, or green. This may indicate an infection. The client's reaction. Record and report if the client seems to feel discomfort or complains or seems depressed or frustrated. The best time for making observation is when assisting with routine care. Now, let's go to a checklist that help the client on assisting a trach. Explain the client what you plan to do. Wash your hands. You have to assemble equipments that you need. There are solution container, applicators, or special gauze. Why clean cut dressing if used? Special tape for neckties, rinse solution. Put on gloves. Pour the amount and type of solution into the container that is specified in the care plan. Remove inner tube if there is one and soak in container of solution. Remove soil or moist dressing and throw it away. Dip applicator or gauze in solution and clean around outer tube. Throw away applicator or gauze. Clean the skin under the neck plate with applicator or gauze. Discard. Sige na, punta na ako dyan. Apa, apa, tawagan ko po kayo. Okay, okay. Okay, now let's move on your roles in assisting with tube feeding. You may be assigned to assist with tube feedings under special circumstances.